Hi, everyone. Hi, my name's Eric Bolesh. I'm the Chief Operating Officer here at Cutting Edge Information. We're getting ready to kick things off here. I know that people are still joining, but I do want to get into some housekeeping points. But first of all, I hope everyone's having a good day so far. I hope everyone is safe. I hope everyone's healthy. I do want to cover some points up here first before we get into the agenda. First of all, we want to make sure that you can see and hear everything clearly. And I'll call your attention to the questions pane that's up there on your screen. You can use that to interact with us. So if you're having any trouble, let us know in there. Nobody but us can see the things that you type in there, so you can use that box to really have a dialogue with us if you'd like to throughout the webinar today. If you have any questions or comments, please use that space. We may not be able to directly respond to your comment in the webinar proper, but no matter what, we will follow up with everything that everyone says, which is something that you webinar veterans or veterans of our webinars in particular will know about us. Two other final points. You will get a recording of the whole webinar. Everyone always wants to know that, so you will get an email with a link to things. And then when we're done, please take a second to fill out a short survey that will pop up on your screen. We really do value what you have to say more than you probably realize. So if you could take a second to do that, we appreciate it. Okay, let's get into it. Today's topic really brings us back to the basics of fair market value. We have started to cover more and more complex subjects in all of our recent webinars, and we sometimes forget that it doesn't hurt to revisit square one. Our clients have reminded us of this. We started to get requests for a session that covers some of the basics, covers some basic ground, and that's what we have on tap for you today. So even if you're a veteran of this space, we hope that the content proves useful. If nothing else, we know that teams are always looking for training content, and hopefully our slides today may help to fill some of that need for you. And one final point. Our fabulous design team is always keeping us on our toes with their themes for these webinars. Today is no exception. Today it's a back-to-school scheme, which corresponds with the whole FMV 101 concept. And I bring that up now because on the next slide, there you go. You'll see that our design team managed to dig up some old yearbook pictures for today's speakers. Which basically means one thing. It means I apparently don't have the editorial control that I once thought I did. So it's a good eye-opener for me. But here are our two speakers for the day. It's me and Jacob Presson. We've both been here at Cutting Edge for several years now, and we've helped to evolve our FMV methodology and product. We work with the data team, and we especially work directly with clients as they are selecting and implementing FMV rates. Okay. Today's agenda. Here are the things we'll be covering today. First of all, we'll quickly level set everyone around our methodology, which we always do at the top of these sessions, just to make sure we're all on the same page. Then we will get into talk about fair market value. So what is it? Why do we care? And that will allow us to dive into where FMV data comes from or can come from. And that will bring us into a discussion of industry standards and best practices for actually using FMV rates in the field. So what happens when you have to deploy this stuff? And then before we get to questions, we'll consider the impact that the current pandemic is having on the FMV ecosystem. So first, a couple of quick slides on where our FMV data comes from. Many of you know exactly who we are, but we have been around since 2002. For the last several years now, we've been solely focused on issues of fair market value compensation. And that goes for markets around the globe. So at present, we provide FMV rates for more than 130 different countries and regions around the world. The research methodology is based on a couple of different things. So we run an annual data collection initiative, and that involves surveys and perhaps more interestingly, the collection of actual rate cards from the industry. So we gather all those points of data, which allows us overall to collect hundreds of thousands of observations of rates being paid. We put that data through a model that incorporates a host of market and economic factors, and we produce hourly FMV rates. That's our product. Many of you know this, hourly FMV rates. And the topics that we'll discuss today are directly connected to this process. We're not putting rates up on screen, but we are going to talk about issues connected to FMV and the knowledge that we come by in terms of getting the data, deploying rates, working with affiliates is really a byproduct of doing all this data work on the back end. Okay, so here's the first of our sections, and I'm actually going to hand things over to Jacob now, who will walk us through exactly what FMV is and how it impacts us.
Thanks so much for that, Eric, and I'll echo that thanks for everybody who has joined us today. So to start off with, I really want to make sure that we are all operating from the same baseline set of definitions. So our focus today is going to be on any transfer of value. So that can be monetary compensation, but also meals, travel, promotional items between a manufacturer and an individual that has an influence on the approval, distribution, payment, prescription, and or use of said products. Obviously, I know that covers a lot of individuals and a lot of transactions. CEI is mainly focused on offering guidance for monetary compensation to HCPs, but do know that the FMV world goes far beyond that into understanding bona fide services and clinical trials. But for the sake of our discussion today, I'm going to be focused on the HCP engagement aspect of our work here. Now, for those of you coming from a compliance function perspective, you are often considering the risk mitigation component of your role. One moment, sorry everybody.
I think Jacob is switching his microphone, everybody. He's getting some feedback that it's tougher to hear him than we want it to be.
Eric, is that better?
There we go.
Awesome.
It is better. Thanks, Jacob.
Sorry about that, everybody. Hopefully everything I just said was covered on the slides and nobody is lost, but I'll pick up where I left off. So I know that when we're coming from a compliance function perspective, you're considering the risk mitigation component of your role. But naturally, when we have a definition this broad, we really need to assess that risk carefully and take appropriate action. Now, I know that this definition might be a little bit too basic for some of the audience, but I like Eric said, we're framing this as kind of an entry-level class. So I do want to make sure that we're all kind of working from the same kind of knowledge and also underlying assumptions, which is a kind of a theme that we'll get back to over the course of this webinar. So now that we've got a handle on the scope of what we're talking about, we do want to make sure that any of these compensation amounts meet fair market value standards. And I will go ahead and say that for the purpose of this presentation, I will rely mostly on US law. There are other variations of what exactly constitutes fair market value around the world, but on the one hand, the US law seems to be one of the biggest areas of interest for our clients, and it does share a lot of common ground with other versions around the globe. So I do feel like this is a good basic grounding principle that we're starting with here. So in this slide, I am referencing the Stark Law, which is a pretty common touch point on FMV in the US legal context. We'll certainly talk about other relevant laws shortly. So in summary, we're talking about the price that comes as a result of bargaining between two well-informed parties. And importantly, these parties who are not otherwise in a position to generate business for the other party. And this is where it really gets tricky, because we're asking people to bargain as if there is no potential conflict of interest at play here. And the reality is that anytime the industry is working with an HCP or another member of the healthcare community, there's quite a lot of potential for a kind of conflict of interest. So this is honestly at its core why FMV is such a big deal for us and for our clients. So when we talk about the regulations to consider when working with HCPs, they fall into two main categories that may overlap in some jurisdictions. So you have payment regulations, and this is where FMV really comes in as it affects what you can pay HCPs and other stakeholders. This category also includes more heavily regulated markets like the Netherlands, for example, where an active rate cap is in place that strictly limits what you can pay. The main goal here with this type of regulation is to reduce corruption and potential conflicts of interest that may come up, like we already mentioned in the previous slide. You also have transparency regulations that are designed to encourage or force the reporting and or publication of payments from the industry to members of the healthcare community. This is a relatively more recent phenomenon. It kicked into a higher gear with the passage of the Sunshine Act in the US a decade ago, although the concept and legislation certainly does predate the Sunshine Act itself. Now, the stated aim of these regulations is to increase public awareness of these transactions and improve patient decision making. It is worth noting that several studies on this topic have shown that the kind of stated aim of these transparency regulations isn't really effectively accomplished by the databases that are currently being published, and that the public doesn't really understand how to use this data in the first place. So this is an area where if governments do feel pressure from their constituents in the short to midterm future, we may see some shifts in the specifics of the regulation. So kind of from a legal standpoint, why do we care about FMV? And I've touched on this a little bit, but I want to dive in a little deeper. So as I already mentioned, we're dealing with multiple high-risk areas of interaction between manufacturers and prescribers. And what makes this particularly high risk is that when the industry works with payers, approval agencies, or physicians, conflicts of interest can cost the industry, it can cost the government a lot of money. And obviously, while governments are also looking out for their citizens and for the general public, they have the most punitive or regulatory power when it comes to their own financial interests. And so in the US specifically, the government has a lot of tools that they can use to curb this type of behavior. There are anti-kickback statutes that prohibit any transfer of value that might induce a healthcare provider to provide services or prescriptions that are paid for by the government. And since in the US you have many citizens that are part of the Medicaid and Medicare government-run payer programs, this is a powerful weapon. Along the same lines, you have the False Claims Act. This puts severe penalties on submitting any kind of claim to the government that is knowingly fraudulent. It's worth knowing that in the US, the False Claims Act accusations can be made by whistleblowers under what's called a qui-tam lawsuit. This is effectively a whistleblower lawsuit. And what makes it particularly interesting is that this allows the whistleblower to claim a part of any settlement reward that the government extracts from a violator. And other companies do have or are considering developing similar whistleblower statutes. You also have the Foreign Corrupt Practices Act. This is commonly abbreviated to FCPA. This is one of the most far-reaching of the tools in the government's arsenal. It was originally designed to prevent US companies from bribing or inappropriately influencing overseas officials, but this now extends to any act of foreign bribery which is supported either directly or indirectly by actions in the US. And yes, in many cases, paying an HCP or any government official inappropriately does constitute a bribe under the FCPA. So it's very relevant to what we do here. And then finally, we have the Sunshine Act, which we already touched on a little bit as an example of really transparency-focused regulation. And of course, in addition to the legal requirements, there are several good reasons to maintain a robust FMV system from a business standpoint, especially in this day and age with the economies around the world surrounded by uncertainty. Budgets are limited, and teams need to be using these resources efficiently. In addition, it's important to avoid even the appearance of an improper payment. And our goal in helping you develop an FMV system is to do so while still remaining competitive and while paying HCPs fairly for the time that they spend working with you. And then, just broadly speaking, we all have a responsibility as good corporate citizens to represent the best of our industry and ourselves. And since we're talking about the business standpoint, I'm actually going to hand things back over to Eric for a moment.
Thanks, Jacob. Yeah, it's time for the first of our 2 poll questions today. So we have one poll here and then one towards the very end of the session. But the question here is how do you expect the total number of HCP engagements to change in 2021, so next year, 2021, compared to 2019, last year? So you'll see we're ignoring 2020 as an anomaly. Hopefully by the time the calendar turns over, things are starting to return to normal. And we really do mean all engagements here. So virtual, in-person events, everything, all of these HCP engagements. And we will let folks respond. We can all see the numbers changing here as we get answers in. And once they start to settle out, Jacob, I'll hand it back over to you. It seems like there's an emphasis on more. What do you see in there, Jacob?
So I mean, I think what we're seeing is really quite a bit of optimism from the industry, which is honestly super encouraging. This is what we're obviously hoping to see. I know that this year we kind of left out the data because we know that this year is going to be a significant aberration. But I do think certainly we are seeing some companies indicate that they are going to just have fewer resources, and so we are hoping that some of the tools that we talk about later, we do have a section dedicated to COVID-19 coming up that will hopefully explore some of the ways that companies are maybe going to be changing their approach so that they are able to continue growing as the world continues to change around us at a very quick pace.
And Jacob, if I could jump in here, we do have a comment coming in on that budgetary point and the prospect of having fewer engagements or maybe spending a little bit less on HCP engagement, which fortunately, for better or worse, is in the relative minority according to this poll. But the comment is around what it means to balance the competitiveness of FMV payments to our physician partners and non-HCPs along with budgetary issues. And so I'll say that one thing that we see, and this is especially true in different affiliates, it tends not to be quite as true in the largest markets. But as we deploy rates and help affiliates to set rates, there can sometimes be a concern about budgets. And they can say these rates are great, but we need to be concerned about what we're paying. So that's a concern as well.
Awesome. So thanks everybody for participating in the poll, and so kind of moving on to kind of what the worldwide landscape looks like. And I'm hearing that I have overcompensated a little bit with the volume. I do hopefully this is better for everybody, and I hope I didn't break any eardrums. in in the process of doing that, we will try to get the audio nailed down here. So I know that we've focused on the U.S. as our main touch point so far, but I do want to make sure that I touch on the global landscape here for a moment. So things kind of break down into two major forms, and this is true in the US and overseas, but I'm going to highlight overseas examples for the most part. So in countries like the US, France, Belgium, Brazil, and South Korea, it's mainly laws from federal and or local governments that are going to be the ones enforcing FMV payment regulations and transparency guidelines. And so to get a better handle on these, your best option is going to be working with a local law firm or leveraging your country level teams. But I will say that in countries like India, Australia, and Turkey, it's primarily the industry groups that set these standards. And additionally, the main industry group in Europe, the EFPIA, has put a lot of work over the past couple of years into codifying a consistent set of industry group requirements that they encourage each local group to kind of implement on the ground on the continent. And so this is something where we would encourage folks to work with the industry groups who are typically going to be well positioned to support you in understanding what your options are and how to best implement any guidance that they have. So the main goal here with any kind of transfer of value between the industry and an HCP is risk management. And our game plan really boils down to mitigating the risk as much as possible with clear documentation of what is required from every engagement. And we'll dive into this a little bit more in a moment. It's also important that companies focus on communication with the teams working on the ground to understand their concerns and potential issues. And the other thing is that with solid communication from the top down, you can quickly identify problem spots quickly and be a resource for teams when they run into issues. So really, this is about determining a team strategy for your entire organization and then really consistently executing on it. I'll hand things back.
Okay, great. Thanks, Jacob. Okay, so thanks. That's where the concept of FMV comes from. Now, let's take a look at the actual data. How do we know that what we are paying to our partners in the different facets of healthcare aligns with fair market value? So Jacob is going to show us where the rates come from, and he'll touch on how companies turn some of that data, which can be relatively raw, into fully deployed compensation systems.
Awesome. Thanks, Eric. So like Eric said, where do these FMV rates come from? So right now, most companies will bring in an independent third party for an evaluation. This is important because remember, compensation levels, according to the legal guidance, should be set as if there is no conflict of interest and as if the bargaining is taking place without the potential for a conflict of interest. And so I know that some companies do try to set their own rates, but it makes the process much more clearly independent if a third party conducts the analysis. Now, a common option in the industry is to bring in a consultant to do the assessment. This often involves an individual or team coming into the business unit, assessing the historical data of payments that the company has been paying, and then using the consultant's industry knowledge to provide feedback on appropriate compensation levels. You can also purchase market-based rates. This is what CEI does, and this is what we provide to our clients. We strongly believe that this provides the most accurate data for users because it is based on what the industry is paying on a global scale. And this keeps you both competitive and compliant. Now, a third option is using salary-based rates, which in our opinion can be slightly limited because salary data is not always available in different markets. Uh, if you're interested in diving further into how to determine FMV and understanding the options in this space, you can check out our previous webinar that we just did about a month ago that reviews those options and will hopefully help you understand more about where the data might be coming from. Now, once you have identified the source of your data and you bring it into your organization, you do have a couple of choices to make. Do you want to publish a single rate for each tier, title, and country combination? Or would you rather set a range of acceptable rates? And this will a little bit depend on the culture within your organization as well as how much flexibility you want teams on the ground to have. You may also want to look at how your previous payments have been received and use that to determine if you want to adjust your rates up or down, and also compare that data to the FMV rates that you have just received. And then finally, especially if you're coming from a global perspective, it's really important to involve the local operating business units in these discussions, especially when you're operating in markets that have rate caps or other restrictions on HCP engagements. These local business units are going to be your experts and will help you determine the best way forward. Once you have identified the specifics of the rate you want to use, now you get to the fun of a deployment process. Now, naturally, the first step here is determining your distribution channel. I know many companies have PDF or Excel-based rate cards, which can be shared throughout the organization. In other cases, you may be able to plug rates into a software system for contracting and/or engagement tracking. We also do have many clients who use CEI's FMV Connect portal to share rates across their team. So you do have a lot of options there. And again, this is a decision that you'll want to make based on what is most appropriate for your end users and based on your group's priorities. Alongside a rate card or other rate documentation, companies do need to have a set of best practices in place. This is ideally going to be codified in a standard operating procedure or SOP document that clearly defines what constitutes an appropriate engagement. This best practices document will also cover travel and prep time policies. This is something I will get back to in a little bit, I promise. I have talked a bit about the differences between how local and global groups tackle these kinds of discussions and deployments, but let's break that down a little bit more in detail. So certainly both groups want to have some kind of assumptions document that specifies what data is being deployed, what assumptions were being made, and how the data is supposed to be used. And we already covered the importance of an SOP that details best practices for setting up and executing engagements with HCPs. If you're a local team, be as specific as possible in the SOP document so that teams on the ground know exactly what is expected of them. Ideally, you will feel empowered to leverage your expertise on the local legal situation and help your teams follow any guidance. If you're operating at the global level, sketch out a best practices guidance that are universally applicable and then work with the teams on the ground to implement them. And of course, it's always going to be important that you're setting these clear policies on travel, mealtime, and other policies. And again, I will touch on those in a moment.
Okay, thanks, Jacob. So we understand now where the FMV data comes from and how the data reaches the field. But when it comes to tackling FMV challenges, we want to take a look at what some of the best practices and approaches are. So in a nutshell, what is industry standard?
So I'm going to start off by discussing tiering, because this is obviously a big component of setting your rates and appropriately contextualizing the rates that you publish. And when you're considering your tiering practices, the first step is that you want to set out objective criteria that are relevant to the expertise you hope the HCP will bring to the table in the speech or consulting engagement or advisory board or any other event. And naturally, these criteria then need to be consistently applied across all specialists. So I do know that tiering nurses and other non-specialists can really be a challenge. And many clients, as a result, have 2 or more parallel tiering systems in place. That's fine. The important thing is to make sure that you are consistently comparing apples to apples here. And unfortunately, just like little Pluto had to be removed from our solar system a while back, you do want to try and update the HCP tiering on a pretty regular basis. Certainly for tiering, most of the time HCPs will go up, not down, but this is still an area to consider just to make sure that your rates are still comparable to the HCP with whom you are engaging. And I do know that exceptions handling, both in the tiering world and just in the rate world, could be a bit of a proverbial Death Star for some of us because I know it makes life complicated. But it is important to preemptively have a system in place that your team knows to follow. I promised I would get back to prep time and travel time considerations, so let me cover that at a pretty high level here. So the current industry standard is to pay HCPs for travel or disruption at around 50% of the hourly rate. This can be implemented in a number of different ways, but the underlying assumption is usually that you're paying them for 50% of the hourly rate for the time that they are spent traveling. Meal allowances are typically going to be set relative to local standards. This is primarily because it can really be complicated to enforce a specific currency restriction in international travel, just because changes in purchasing power can be very significant between markets. And then just to touch briefly on prep time, this is most often paid at the same hourly rate as the activity itself. I will add here that we did a full webinar on this topic last year. It may be useful to those of you hoping to dive into this topic further. A link to this recording, along with the one that I mentioned earlier, will actually be shared with you in the follow-up email that you will receive later this week. So feel free to check those out. It might be a nice deeper dive for those of you who want to go a little deeper than just kind of our entry-level 101 little course. So to kind of summarize what we've gone through here so far, our goal is that every team has an independent evaluation of their rate card structure that has been completed, a clear set of documentation and operating procedures that's been published, some kind of formal rate guidance that's been distributed regardless of how you choose to do so, tiering systems that have been appropriately established and are consistently applied, and also that you have a good understanding of your travel and prep time policies in your market. And hopefully, once all this is said and done, we'll pass our proverbial FMV exam day with an A+.
Great, thanks, Jacob. Okay. This brings us to our final section of the day, which is a challenging one, not one that we would have hoped to be talking about. But Jacob is going to take us through some of the changes that we've observed in the HCP engagement landscape as a result of the pandemic. But before he gets going, we do have the second of our 2 polls, and I'm going to bring it up here. So the question here basically revolves around, as we all grapple with the new normal, we're curious to hear about what your biggest challenges have been with regards to HCP engagements throughout the COVID era that we're all navigating. So we'll give you a chance to read the options there and make some selections. Just one biggest challenge. These may all apply, but if you could pick one, what is the chief challenge that you're facing? And we'll give everybody a second for this because there is some reading. reading
It,
involved
it
here.
does appear like an early major challenge are the contractual issues. This is something that we've talked about with a couple of our clients, and certainly understanding that in I know that in some cases the contractual issue has come from internal legal groups that just aren't as flexible in terms of switching events over, and in other cases the contractual issue has come from the HCP side. I am also interested to see that that the two other front runners are related to virtual events, whether you're trying to justify the utility of it or just trying to get HCPs to wrap their minds around it. And certainly these are kind of, as we talk with clients, the two biggest stumbling blocks that we come across in the virtual landscape. So thank you all. Certainly, if you have any additional thoughts on how you've tackled those challenges, we'd love to hear from you in the Q&A panel. Certainly would love for this to be a two-way conversation in terms of everybody learning a little bit more about what the industry is doing, and hopefully we can share that with everybody. And I'll go ahead and take us right into some of the findings that we have related to COVID-19 and how the industry is responding. So I want to make sure that we offer kind of just a summary of our understanding of where things stand. So what we do see is that the increase in virtual events is likely to last through 2021 and beyond. So this is not a short-term trend. The other thing that I will say is that payment for virtual events is typically considered to be equivalent to an in-person event minus the travel time payment. Obviously, none of us are really traveling right now, but in terms of the base hourly rate, it seems like virtual events are treated as rough equivalents to an in-person event that may have been conducted, back in the normal times. I also wanted to give a breakdown of what we are seeing in various types of engagements. This is all preliminary data from a survey that we are currently running on this topic. Overall, most consulting engagements and advisory boards have been able to continue mostly otherwise unchanged by switching to a virtual format. Speaker programs, however, have been the most heavily affected, with many canceled or postponed. However, we do see a small majority of companies that have been agile enough to move the bulk of their speaker programs to a web-based format. And so obviously, even in this crazy time, we are seeing some real success stories in terms of the industry being able to adapt despite everything that's going on. Just one last point that I want to cover here before we close out today. We do see from the early data that speaker programs and advisory boards are the most likely candidates in terms of specific events to stay web-based in the long run. And this is partially down to budget. We actually have reports from some companies that the cost savings from virtual events are significant enough that they plan to continue using the format in the long run. And certainly part of that long run future will depend on how HCPs feel about the events and if companies continue to find value in them. But the early findings indicate that the cost savings are significant enough to justify a long-term virtual program function.
Okay. Well, that brings me to the final point for today's webinar. So we're right at the end now. We want to make everyone aware of complimentary rates that we are providing to companies. So we're giving these 2020 hourly rates away for any HCP or non-HCP who might be relevant to our collective fight against the novel coronavirus and COVID-19. Really what it comes down to is I think everyone is trying to figure out how they can make even the smallest of contributions during this time. And this is one thing that we can do. So we're giving the rate data away. We've already given it to a number of clients. Some have simply wanted to update their rates when it came to specialists they're engaging in terms of pandemic response. And other companies have executed or are executing a pivot to engage with new types of specialists for the first time. So whatever the case, if you're interested in this, please send us an email. You can put a comment in the Q&A pane. You can use the email address that's at the bottom of the slide, and we're happy to provide you with data. It doesn't have to be these particular titles that are on the screen. There may be some others that are of interest to you around COVID-19, and you don't have to be a client either. We know there are some companies in the audience today who aren't using our rates, and that's fine, but if you can use these rates, we would certainly feel good about that. So just let us know. And I'm going to put this information up again later too in the next slide, so you'll have the contact info in front of you and take a second look at it. Okay. That's pretty much it for the session today, apart from some Q&A. So we'll dive into questions in a moment. Again, please remember to fill out that survey after we're all done. We're always very interested in hearing what you have to say. Apart from that, if you can, do join us in September. We'll get back into some more complex topics as we take a look at FMV rate deployment, which can be a real rabbit hole or can of worms or whatever metaphor you want to use as you go region by region and affiliate by affiliate. And lastly, of course, again, do let us know if we can help you with rates that can aid in the fight against the novel coronavirus or COVID-19. Okay, let's get into some questions. Now, I'll remind you, some people have been using the Q&A pane throughout, but if you do have any questions, please go ahead and throw them in that pane, and we will do our best to get to them. We'll probably take about 10 minutes on questions here. If we don't answer your question or comment directly, we will follow up with you. So here's one of the first questions. This topic has come up a couple of different times today. Jacob, are virtual events really itemized on rate cards? So are we seeing rates spelled out for virtual events? Or is, I guess the reading between the lines, the question there might be, is this an ad hoc decision or pivot that companies are making? So what are we seeing there, Jacob?
So it certainly was, I would say 2-3 years ago, relatively uncommon to see a virtual event specifically spelled out in a rate card, but almost in anticipation of almost as if in anticipation of what we've seen today. Over the past couple of years, we did start to see them pop up, although I certainly wouldn't say that a majority of the documentation that we saw included specific virtual event rates. We do see a lot of companies now trying to find ways to add that information into their rate cards. Of course, the good news is that, like I mentioned, companies are treating virtual events as roughly equivalent to an in-person event, and so the main work here is to make sure that people understand that that rates should not include travel or disruption time compensation, simply because it's really very difficult to justify that when the HCP is still staying in their location.
Great, and I do want to touch on a comment that somebody made earlier in the webinar, where they brought up the fact that in switching to these virtual rates, they're being compelled to use flat rates, which is a single flat fee to pay for an event, as opposed to calculating compensation for the virtual event via an hourly rate. So the focus has switched for them from an hourly rate calculation, where I'm assuming you're multiplying the hours. It's usually how it goes. And instead, it's just a single flat fee. And this could be the case. In rate cards, we see all kinds of different approaches to the calculation. But the point I want to make is that whether you're talking about flat rates or you're talking about hourly rates, those two things are not mutually exclusive. And what we tend to advocate, and especially as we're helping clients build rate cards and deploy those rate cards, is we try to advocate for that the flat fees being derived from a base hourly rate. So no matter what kind of activity you're engaged in, whether it's virtual, in person, an ad board, speaker program, another kind of consulting arrangement, you're still deriving your compensation from that base hourly rate. So in what you get is a system that makes sense. You can just multiply different numbers of hours. You can bring in different issues of role modifiers. So maybe someone's a chair, maybe someone's sitting in the audience for something. Prep time, acclimation, all those other things can be calculated, travel especially, as Jacob alluded to, as an offshoot of that base hourly rate. And you also have increased transparency. If everything comes down to a one single hourly rate for a particular tier of specialists, then it tends to be a little bit clearer where the actual engagement fee is coming from. So bottom line there again, and I know I'm rambling on a little bit, but bottom line there is that flat rates and hourly rates need not be mutually exclusive, and that you can create systems that account for both. Okay, moving on to another question. Jacob, how often should companies refresh their rates?
So typically what we advise companies to do is shoot for a refresh every 2 to 3 years. We have had companies come to us and ask for refreshes every year, but the reality is that it's very rare for rates to change significantly year over year. What we do see, though, is that over the course of 2 to 3 years, those small scale changes do start to accumulate, and at that point it really is worth looking to refresh your rates a lot of times just to make sure that you're staying compliant, but also staying competitive with your peers within the industry. Some markets certainly do go down due to regulatory pressures, but we do a lot of times see certain rates go up as competitive pressures accumulate. So every 2 to 3 years is a rough guidance on that topic. And also, just to add on there, that seems to be also a pretty good rough outline for the tiering question as well. You want to make sure that you're trying to go back and reassess the tiering of an HCP relatively on the same kind of rhythm.
Great, Jacob. Thanks. And we have time for 1 or 2 more questions. We're trying to get everybody out by 10 minutes of the hour. So this is a combination of comments and questions that a few people are making. Basically what it comes down to is a company may be set with rates in 1 or 2 major markets. So let's use the U.S. as an example. So if we're set with rates in the U.S., but we're hoping or planning to expand into several international markets in the next year or 2, what does that look like? Someone saying it seems overwhelming, and it can be overwhelming. And paired with that, I'll ask this question. So Jacob, if you can keep this other point in mind too as you're answering. What happens when you get pushback from the field? Because as you roll out to different affiliates, or even in the affiliates that you're used to working in, you can get pushback. And people do talk about internal discussions with their end users or their point people on the ground about why the company pays what it pays. So it's kind of a two-parter.
So,
Jacob.
I mean,
how do you expand into international?
Yeah, and I certainly do understand where you're coming from with the question, because depending on where you get your data from, it truly can be overwhelming. And so one of the first things that we try to do when we work with clients in the deployment phase is almost off the bat try to identify ways to try and simplify as much as possible and get down to what is your core objective. Is your core objective, meeting the competitive needs in the market? Then we might push you to, all right, let's just focus on rates at the top end of the range. But on the other hand, if your core objective is we just want to stay compliant, we have a very conservative corporate culture, you may decide, all right, we're going to focus on this range of numbers at the lower end. So again, it can be overwhelming, but the first steps to take are finding ways to simplify, whether that is a certain range of rates that you then look at to find what you're going to target, or are you going to try and simplify by maybe combining similar titles that have comparable compensation levels and then deploying those in bulk. And especially with large companies, this is an approach that we have taken. But again, this depends a little bit on your priorities. If your priority is extreme ease of use, then we may go that route. But some companies want to have as much detail as possible. And so there are other options there to make the data appear a little less overwhelming, both for those of us responsible for deploying it and for the end users on the ground. And so I know I know that sometimes the data can appear overwhelming, but certainly that's something that we view as part of our role to kind of help companies understand what their options look like.
Great. Okay. All right. I'm going to bring things to a close here. I'm throwing this information back up on the screen just for a minute as I close things out. We've already received some emails actually requesting these COVID-19 titles, so please do get in touch with us if you have any questions, any points of feedback. We'd love to hear from you. Do stick around for a moment to fill out the survey, and for everybody here, I just wanted to say thanks. We really appreciate your time this morning. We wish you the best of luck, and we hope you all stay safe and healthy.
Thank you, everybody.
Goodbye, everybody.